Hi, well, I'm Tim Erikson, and I'm going to talk to you about neurocysticercosis. That's that word. So neurocysticercosis is the result of infection with the larval stage of the pork tapeworm Taenia solium, and it has a very interesting life cycle. We got to understand that to really understand our research. So it starts with you eating contaminated pork. You grow a fairly benign worm in the gut, and then every time you go to the bathroom, you shed about 20 to 30,000 eggs. And these eggs, then, if maybe you don't have the best bathroom habits, they get up under your fingernails, and for the next several days, as they dry out, they fall down in a foul little rain, and everything you touch becomes contaminated. Now, if you ingest this egg the second time, that's when things get really problematic. Instead of getting a fairly benign tapeworm, you get the larva, and they go up into your brain, and you start to have blurred vision. Then you have headaches. Then you have seizures, and then you die. So it's a very serious condition. Traditionally, we've believed this to be an immigrant's disease, and a disease that's related with travel. People go places where people are carrying this worm around in their guts, they get sick there, they come back, they have neurocysticercosis. Recently, though, we've started to see case reports that suggest patients without any travel history in America are developing this particular disease. So that's very concerning. What I did was I put together a very large study. It's actually the largest study in the history of the state of Texas now, to see the epidemiologic characteristics of this disease and see, maybe we can say a little more about transmission by looking at it from a larger standpoint. And so what we've got here is a map of where I found cases in Houston so far. Yellow highlights are particularly interesting because those are zip codes in which there are patients who said they had never traveled anywhere. So about 10% of our patients actually said they'd never traveled anywhere. And this is actually quite a big finding because remember, this is supposed to be the immigrant's disease. This is supposed to be the travel disease. You're not supposed to be getting this in the United States. So it really does look like we have some transmission right here. And if you look at it, some of it's a fairly classic epidemiology spread. You have areas of concentration. They get a little less concentrated as they go further out. And we think that this is pretty good evidence that there's transmission of cysticercosis right here in Houston and in Texas. So why do we care about this? Well, aside from the fact that it's pretty horrific to eventually have seizures and death, aside from the fact that it's extremely expensive, $60,000 a case is a low number. I've seen 100,000. I've seen quite a few different estimates. It's really concerning to me because there's nothing you can do to prevent cysticercosis. If it truly is transmitting in Texas, which is, I believe, the logical conclusion from that data, then you can't stop getting it. You can't stop yourself from getting it. You go to a restaurant, maybe it's in your hamburger, it's in your chicken, it's in your salad. You don't know if the server bringing it to you has that worm in the gut. You don't know if the cook had that worm in their gut. And then you run the risk of getting those eggs and you eat them and you develop cysticercosis and eventually you're going to die. And that's a real severe problem, and I think it makes a perfect candidate for public health interventions and a great candidate for a 3-minute thesis speech. Thank you.